Hi, this is Dr. Subramanian. Today we will talk about OTC medicine, over-the-counter medicine. What is it? OTC medicines are medicines basically for which you don't need a doctor's prescription. You can just go to the pharmacy and request for it. For example, for a paracetamol, you can just request and they will give you the medicine. So you don't need, there is no mandatory requirement of any prescription from a doctor. Why is it that? It is to ensure that there is convenience and also immediate access to immediate treatment that is needed. Most of these medicines have a very big safety window, so they are quite safe to be used by layman when given in an appropriate dose. But still, they can cause problems. For example, paracetamol poisoning is a very common poisoning that we see in children, and often so because of inappropriate dose. And parents often mistake and give the wrong dose to a child. Why does this happen? How do we stay safe from giving these OTC medicines? When you buy OTC medicine, make sure it is the right dose that you want, the right strength. For example, a liquid paracetamol that is available in the market comes in various strengths. It can be called drops, it can be suspension, it can be double strength suspension, it could be 500 mg suspension. So it comes with the same name with different strengths. So ensure you buy the right strength. So don't go and ask for paracetamol just like that or a brand name. I don't want to use the brand names, for example, Crozin or Calpol. Ask for what is the strength that you want so that you are getting the right medicine. So that when you give the ml dose, it is the right dose. You also need to understand that some of these medicines come as combinations. Some of these OTC medicines, for example, cold and cough syrups often come as a combination. When they come as a combination, some of them will have paracetamol also. And if you're giving paracetamol separately, double dose of paracetamol happens and it can often lead to overdose. So be very careful when you are buying medications that are combinations. So make sure you read the label properly. Make sure you read what are the contents and what is the strength of the medications that are there in that properly. Third, most important and most common problem is using an OTC that is not meant for a given child. Using an adult medicine into a child, giving an younger child's medicine to the older child or older child's medicine to the young child by simply adjusting proportionately the dose. This can lead to problems. So very important, even though they are OTC, find out from your pediatrician what is the right strength, what is the right medicine that needs to be given in case of a problem. Then buy your OTC medicine. It is always better. Stay informed, stay safe.